Good day. It's nice that you're here. We are going to talk about our rejuvenation programs and regenerative programs today. Well, my professional journey started a long time ago. I'm not going to mention it, but at the beginning, I was very much involved in the fetal-maternal medicine. This is the medicine dealing with the fetus and his development, and also the influences of mother to the fetus and fetus to the mother. At that time, I realized that actually majority of the serious problems that we encounter during the pregnancy, even later in life, for the unborn and unborn person, as well as problems with the mother and reaction to the fetus, comes because the embryo that implanted was not ideal, or the process of implementation was also not ideal. Trying to see how to act on these very complicated and very early days, even before life, we came to conclusion that the egg, the oocyte, and the quality of the egg and the quality of the spermatozoa that produce embryo actually influence the embryo quality, and the interaction of the embryo to uterus is making the placentation, or something that these two factors are actually the most important for the development of the fetus and later on of the person born from this pregnancy. I was long and I still am in that field, but the crucial thing was to realize that we cannot treat properly consequences of something during the pregnancy, because at that time what we see is actually established during the formation of the cells that give embryo. So this moves medicine to much earlier phases. Today we are completely aware that taking care of someone's future health happens before even the embryo is created, while the cells are created. So the last few decades we are dealing with increasing the quality of the cells that produce human being. Yes, actually I like to say that and it really is, it's a teamwork and we work together, and I'm happy that our team produced a lot of innovations in this field, and we are on the forefront of this type of medicine globally. In second part of my career, I was a lot involved in minimal invasive surgery, laparoscopic, and all the advanced techniques of this type of surgery. And this is actually important because then from the inside you know what really can be done, or technically what we can achieve. It is not only to have the idea, but you have to do it, to make it happen. So I think that this part of my professional career contributed a lot to all the procedures that we are doing today, because some of them involve some kind of minimally invasive surgery. So to conclude about the journey, these two aspects, fetal-maternal medicine and minimally invasive surgery, brought me, together with the knowledge we experienced from that, to the very early stadium of the future creating of the human being. So we came to be involved with the IVF more than 35 years ago. And for the last 2 decades, we have realized the limitations of the IVF classical methods and techniques that we use, and we were trying for 2 decades to develop next level of therapy, which are biological therapies, and try to use cells and their products and tissue for treating this insufficiency which are necessary for creation of normal human being. To emphasize, the reason that we were actually developing this was that our medicine was insufficient, and that we could not, with classical method, influence those very, very early development of the cells. So this is what we are trying to do now. Our regenerative reproductive program This means that we are using biological regenerative therapies for the purpose of reproduction, has two main goals. One is to improve the function of the ovaries and testicles, and the other is to improve the endometrium and the uterus for the successful implantation. What we have seen is that we are dealing with very complex process, which if we are discussing ovary, for egg, it needs a year to develop completely and to come to be fertilized and produce embryo. The same is for semen, which needs 3 months of the development that we need to try to improve. So we have, for these very different stages, we decided to try to modify them with different active agents. So we are now using comprehensive method that involves different therapies in the same one, and we are using for the reproduction completely autologous technology with own cells and tissues, which we use without any allogenic or foreign tissue or any medication during this procedure. The second characteristic of the procedure is that we use the most advanced technology to obtain these, either growth factors or stem cells or tissue, so it is the best possible today outcome. Very important part of our technology is that we're not dealing only with biotechnology. We try to incorporate really holistic approach. So this means that we are going to examine whole body, try to exclude any disease of some system that was unrecognized before, but can influence this process, and try to optimize whole and do the balancing of the all different system of the microelements, vitamins, oxygen reduction, heavy metals. So try to have the best body possible and to learn our patients to do some kind of trainings that would help us obtain the good mitochondrial level on the cells, because this is also important from our tissue. So to conclude this part, we are giving our best, but we expect our patients to also do the same for themselves. We do know now that we are dealing with either ovaries, testicles, or endometrium, but no organ is by itself. And every organ that we treat, it depends on the good balance of the organism. So either you can have some unrecognized disturbances, for example, immunological, that influence the function of the tissue that we are dealing, or you have in excess, for example, some coenzyme Q10 that can be very increased because of supplements that patient is taking, or you can have heavy metals in your body in high concentrations, which influence the outcome of our procedure. So what we try is to increase the general health of the body, to have patient awareness of necessity to behave in this way. We are offering full help, and then we are doing the whole biotech thing for the patient. To have the best possible balance for each separate person. So this is called personalized medicine. We try to examine everything possible and then to influence to get the best results. There is balance, but the variety of the problems that we are taking is having this expand. So generally we are trying to treat the decline in ovarian or testicle functions. Usually it comes with age. So the average age of our patients is almost 50. And we are talking about reproduction with genetically owned cells. So no donation. The other thing is that this happens even in earlier ages. So we have patients in their even 20s or 30s with ovarian or testicle decline that we are trying to resolve. We have advanced age patients a lot. And we have completely separate group of patients which do not have reproductive problem, but would like to try to help longevity and the quality of life. because we know that as long as the ovary and testicles are working, they are producing very important factors for whole body, not only for their function. So this is very big variety of patients coming for this treatment. The last one is longevity. This is called longevity. We are, by improving the life of the ovaries or testicles and giving also systemically some factors, we are improving the function of all the organs and reducing the effects of declining all the sex steroids produced in gonads to minimum. There are very specific things connected because it is very advanced. It is still not available on a wide scale and people are not so educated. So we have a pretty long period between first information, first contacts and patient coming here. Specifically because majority of them comes from other continents and then you have to organize a lot of things for that. But as I told you, we have practically two components of the therapy. One is biotechnology, for which we are preparing relatively fast, and we have in 10 days we can prepare everything we need to be able to do the procedure. On the other hand, there is a process of balancing everything that we need and excluding some of the factors which needs several weeks or even months just to start to have the effects of the therapy. So we actually have these patients for a lifetime. And when we decide to do the procedure, then he's going to be communication with our team for years, in which time we are monitoring the effects and having the patient do whatever is needed, either for reproduction or for their healthy life. For the reproductive part, it is very easy. We measure pregnancies, so we also measure some in-between markers of the hormones, of the infection, of the immunology. So there is a whole range of things that we monitor, but for us it is expected from these complex procedures to have endocrine improvements, which means that they either ovary or the testicles, not endometrium, but these two are working better in producing hormones. Then we have increased number of follicles produced, increased number of cells, of embryos, and at the end of the pregnancy and children born. So this is something that we actually monitor for years after the procedure, because biological procedures are not like usual drug giving effect the moment you put it in tissue, but it changes the way that cells in the organism are working, so it takes time for the effect. But what we know is that, and what we have is the statistics for the patients with most advanced process in ovarian decline with menopauses, that we have 15% of pregnancies in those type of patients. This means that we are able to increase and multiply their chances a lot comparing to the basic one, which are almost zero. We are using multiple biotechnologies trying to achieve our goals. They're based on 3 different levels, which are practically called basic, advanced, and the complex, most complex. The basic one is used for easier cases, and the more simple one, which has the foundation in growth factors, which means that we use cells from your blood to concentrate them, to multiply them, and to activate the growth factors that are contained in the platelets or thrombocytes. Comparing to commercial variants of this technology, which is used in a lot of other fields, we are using very sophisticated closed systems that enable us to have at least 2 or 3 times more cells than available with other technologies. Then we are using activation that we produce from your own blood, and we are using the parts of the liquid part of your blood, which is called biofibrin, which is for us a matrix or a scaffold on which we apply the cells into the ovary. The reason for doing that is we want all the active particles to remain in the ovary, take effect in the ovary, not to go by vascularization to other parts of the body. This is the simplest one and the most simplest one, and we use it as a day procedure in which cases are being treated daily and they are being discharged the same day from the hospital. In those cases which are more complex and more serious, and in which the first basic level does not succeed, we add stem cells to the therapy. Stem cells are very potent cells, and we use two types of stem cells. One is mesenchymal, which is the structure of the ovary. The other is hematopoietic, which produce blood cells and blood vessels, which is important for nourishment of the increased activity of the ovary. We obtain these cells either from blood or from bone marrow or from fat tissue. So we have pretty big variety that we choose from who to give which type of cells as the advancement. And the other thing in this second level is that we are able, because we are using different sources, to obtain enough cells that we can cryopreserve and then use it later on for boosting the effects of the therapy.